In this video, I'm going to talk about breastfeeding with inverted nipples and whether or not it can be done. I'll also be giving you some tips on how to make it work if you're struggling with this issue. 1. What causes inverted nipples? Inverted nipples are caused by a variety of factors, including genetics, scarring, or hormonal changes. They can also be the result of certain diseases such as tuberculosis or breast cancer. In some cases, inverted nipples may correct themselves with time and proper care. 2. Is it possible to breastfeed with inverted nipples? Yes, it is possible to breastfeed with inverted nipples. It may take some effort and dedication, but many women have successfully done so. To make it easier, there are several methods that can be used to help draw out the nipple and make it more accessible for your baby to latch on. These include using a nipple shield or pump, applying warm compresses, and expressing milk manually or with a pump. However, it is important to consult your doctor before attempting any of these methods. 2. Are there any risks associated with breastfeeding with inverted nipples? Although the risks associated with breastfeeding with inverted nipples are minimal, it is important to check for any other medical issues that might complicate nursing. These include breast infections, blocked milk ducts, or mastitis, which can affect the mother and baby's health if not addressed properly. Additionally, there may be some additional difficulties in ensuring that the baby is properly latched and feeding correctly. It's also important to make sure that the infant is receiving enough milk, since inverted nipples may not produce as much milk as those with a normal shape. 3. What techniques can be used to help with breastfeeding when the mother has inverted nipples? One technique that can be used to help with breastfeeding when the mother has inverted nipples is to use a breast pump before attempting to latch the baby on. This will draw out the nipple and make it easier for the baby to latch on properly. Another helpful technique is shielding, which involves placing a thin, flexible shield over the nipple. This shields the baby from the mother's nipple so that even if it is inverted, it can still be latched on. Finally, using a soft cloth or warm compress may help draw out the nipple and make latching easier. 4. Is there any difference between breastfeeding with inverted nipples and breastfeeding with regular nipples? Breastfeeding with inverted nipples can be challenging, but it is possible. The main difference between breastfeeding with inverted nipples and regular nipples is that extra effort may be needed to make sure the baby is properly latched on. It may take more time in positioning and latch for an effective feed if your nipples are inverted, and you may need to use devices such as breast gels or nipple shields to help create a good latch. It's important to get the help of an experienced lactation consultant if you are having difficulty latching or expressing milk with inverted nipples. Inverted nipples can also affect your ability to express milk, which can be necessary when exclusively breastfeeding is not possible. In this case, you may need to use a breast pump or simply massage the area around the nipple before beginning to express milk. With adequate patience and practice, it is possible to effectively breastfeed with inverted nipples. 5. Are there any products that can be used to help with breastfeeding with inverted nipples? Yes, there are several products that can help with breastfeeding when the mother has inverted nipples. Some of these include nipple shields, breast gels, and breast pump systems designed specifically for inverted nipples. Nipple shields can help keep the nipple in place when trying to latch on the baby during feeding. Breast gels provide additional support for the breasts and may be helpful in helping the nipples protrude. Finally, there are breast pump systems designed specifically for inverted nipples that can help stimulate milk production and keep the milk ducts open. Each of these products may be useful in aiding a mother's ability to feed her infant with inverted nipples. 6. How can a mother know if she is successfully breastfeeding with inverted nipples? Mothers can determine if they are successfully breastfeeding with inverted nipples by assessing their baby's weight gain, wet and dirty diapers, overall comfort while nursing, and the baby's latch. If their baby is gaining weight steadily, has plenty of wet and dirty diapers a day, at least 6 to 8, is content during feedings, and has a deep and secure latch, that doesn't cause pain or discomfort for the mother, then it is likely that she is successfully breastfeeding with inverted nipples. If any of these criteria are not met, the mother should seek help from her healthcare provider or an international board-certified lactation consultant (IBCLC). This professional can assess the mother and baby together, evaluate their latch, and recommend strategies for successful breastfeeding with inverted nipples. Thanks for watching our video on breastfeeding with inverted nipples. If you have any questions, please leave them in the comments section below, and we will do our best to answer them. Remember that it is very important to seek help from a healthcare professional or an international board-certified lactation consultant (IBCLC) if you are having difficulty breastfeeding with inverted nipples. Thanks again for watching.